Hi, Professor in class. This is Kayla Jemison, and I'm gonna read about my informative speech of Hidradenitis Suppurativa. The speech aims to inform the audience about HS and what it does within the body. Hidradenitis suppurativa affects 2% of the global population, and most of them don't even know that they have it. Women are more commonly affected by HS than men, with a female to male ratio of 3 to 1. That's cited by Jamek 2012. If you experience abscesses in areas of high friction and sweat glands, check with your doctor to get a diagnosis. For example, a 36-year-old woman has persistent boils under both armpits and in her groin. They flare before the arrival of her menstrual cycle, causing pain, suppuration, which is like oozing pus, and an odor. The scarring has developed in the groin area, and the chronically draining sinus tracts are established within normal skin, which is cited by Jamek 2012 as well. I shall present to you the symptoms, lifestyle, and treatments of a person who suffers from hidradenitis suppurativa. Let me start off by telling you what hidradenitis suppurativa is. HS is a chronic inflammatory condition that occurs throughout the body, where an overactive immune system stimulates inflammation below the skin surface, affecting skin that bears apocrine glands or sweat glands. HS usually develops after puberty and manifests as painful, deep-seated inflamed lesions, including nodules, sinus tracts, and abscesses. For me, HS developed when I started puberty at 12 years old. In most patients, flares are accompanied by increased pain and discharging pus at various intervals, often occurring premenstrually in women. If untreated, the flares subside within 7 to 10 days, which is quoted by Jamek for hidradenitis suppurativa and NEAM 2012. The disease has considerable negative effect on the quality of life of impacted persons as compared with the general population or with patients who have other chronic skin conditions such as psoriasis or eczema or dermatitis. That's quoted in the hidradenitis suppurativa article of NEAM 2012. Living day to day with this condition heavily limits your mobility due to pain and pressure in high movement areas. Personally, for me, it's under my armpits and groin as well. Smoking and obesity are both firmly correlated with hidradenitis suppurativa, and if you're obese and or smoke, it'll make your symptoms harsher. But no specific diet has been proven to cure hidradenitis suppurativa, and further research is necessary on how food choices may affect the condition. Personally, whenever I consume dairy products, it causes me to have flare-ups and it makes them grow larger faster. If you've ever experienced any abscesses that become large and painful, left a scar when it healed, and cleared but reappeared in the same spot, if you also have these symptoms of abscesses that become large and painful, last for months, leak a foul-smelling pus when they rupture or burst, become connected by tunnels forming deep in the skin, leave a scar when they heal, or sometimes clear and reappear in the same spot, it would be best if you went to your primary care provider, dermatologist, or rheumatologist to get examined and diagnosed. HS is often misdiagnosed in its first stage of development and may be mistaken for different conditions such as folliculitis. Dermatologists often measure the severity of HS in stages using the Hurley staging system. From stage 1, which is mild, stage 2, moderate, and stage 3 is severe. You can learn more about this scale by visiting the website No BS about HS. As HS can advance over time, it's crucial to pay close attention to anything changing or accelerating the symptoms. For example, HS might begin as a bump in your inner thigh, a lump in your armpit that seems like a cyst, or even what looks like a pimple on your groin. While many people are going about life misdiagnosed, a large part of the population often goes undiagnosed. Due to our lack of knowledge on HS, many people don't consider this condition for a diagnosis. There's a scarcity from data of randomized controlled trials due to guide decisions about therapy in patients with HS. That's quoted by Jamek 2012. Controlled trials are needed to compare the effects of different regimens and duration of antibiotic treatment to assess the effectiveness of combination therapy and compare it with monotherapy, and to compare antibiotic treatment with immunosuppressive treatments such as Humira, which I've taken and hasn't worked for me. But that's quoted in Jamek as well. Depending on the stage the patient is in, the remedies to alleviate the symptoms vary. Although there are many ways to lessen the symptoms, there is still no known cause for HS, and furthermore, there is no known cure for this chronic disease. Now that I've shown you the basic knowledge of HS, you can spread the awareness of this condition and look out for signs of it within yourself and within your loved ones as well. HS is a chronic inflammatory condition that affects patients' way of lives with painful symptoms that are often misdiagnosed or not diagnosed at all. Whether you have symptoms or not, learning about this condition can change someone's life by bringing them a step closer to a diagnosis.